Well, good afternoon. We're going to start to do this every day at 3 o'clock to the extent that we have information and updates, so there'll be some predictability to it. But I'm here again with our health director, Denise Fair. It seems like for the last 2 weeks we have been catching up and chasing strategies, and I feel like today for the first time we are really starting to get ahead of some of the problems. And this virus is going to continue to grow in the city for a period of weeks, and we keep talking about social distancing, but for the first time our strategies are getting ahead of it. And so today we did 660 tests at the state fairground site. We're finally getting to the level of testing that a major city and state should be doing. And I'm going to try to ask the media to cover this accurately. I saw a story in one of the papers today that compared the infection rate in Detroit versus the surrounding communities. It is not the infection rate, it's the testing rate. What is happening in this country is most places have very limited testing. The more testing you have, the more infections you find. I guarantee you the Detroit positives will continue to grow because we are doing far more testing than anybody else. And I would hope that those who are reporting on this can understand the distinction between growing positive COVID-19 cases in the city of Detroit because we are doing an excellent job of testing versus having an infection rate. We're now past 1,000 tests at the fairgrounds. Went absolutely beautiful today. I will never be able to thank DMC, Henry Ford, and Trinity enough for what they are doing. Now, here's the next thing that we have to do. We have to make these tests available to every single Detroiter, regardless of whether you have a doctor, even if you don't have insurance, even if you don't have a car. And so now that we have worked out the testing protocols and we've got the labs, we're now going to make sure that we reach everybody. And so I'm going to ask the physicians and clinics in this town to step forward. And if you are willing to take new patients, we'd like you in the next 24 hours to call 313-361-0093. And Director Fair's staff will take your information. At 3 o'clock tomorrow, I want to be able to announce and post on our website for the people of the city of Detroit every single doctor and clinic that is willing to take them. Even if you only are willing to take people who have insurance, call in. We'll post you in a category of people who you can call if you have insurance, and we'll take that. If you're willing to take people without insurance, and we know we've got federally qualified health clinics we've already been talking to today, there's going to be a group of providers who will take people without insurance. But we have got to be able to tie every Detroiter to a doctor with a single phone call. And I'm expecting by 3 o'clock tomorrow to be able to tell the people of the city exactly where you can go with or without insurance to get a doctor so that if you are in fact showing symptoms, you can get a prescription. I've had a number of people contact me saying, I've got symptoms, I got a prescription, I don't have a car. And we have to address the residents of this community that don't have mobility. It is far more efficient for us to bring people to the fairgrounds than to try to get testing materials out to individual homes. And so I have been starting to reach out to the corporate community, and I'm very pleased that at 10 o'clock last night, Gary Torgo and TCF Bank are donating $100,000 to our transportation fund to create the ability to get our residents who need it to the test site. And to Gary and that team, we're deeply appreciative. We are now looking for transportation providers. If you're in the transportation business, and you're willing to do this, we will set up a process where when you drive somebody up to the fairgrounds, you don't sit in the long queue. We'll bring you right to the front of the line, get the patient tested, which takes about 6 minutes, get you back out. We will get you the appropriate protective gear so that you can transport folks safely, and we will pay you fairly for that service. And so anybody out there who wants to be a transportation provider to your neighbors who very much needs it, please call the same number, 313-361-0093, and we will enter into contracts by the end of the week with providers on fair terms, so that my hope is a week from now, everybody in the city who needs a test and doesn't have transportation will be able to get that ride and will get tested. We are going to make testing available to every single person in this city who needs it. The last restriction, as the doctors probably know better than anybody, is that the state of Michigan has put serious restrictions on who can get tested. You have to be elderly, you have to be a healthcare worker, you have to have serious underlying conditions. And there was good reason for that. When the state was doing 100 or 200 tests a day, the state had to be very restrictive on who could get those tests. Right now at the fairgrounds, we got the ability to do 700 a day at one site. We are dramatically expanding this state's testing capacity. And that means we're going to be able to test a lot more people. Dr. Khaldun and I have been in conversations today, and Director Fair will be in conversations again tomorrow. But I'm expecting in the next couple of days that Director Fair will issue a directive that will greatly ease the standards for writing prescriptions for the State Fairgrounds site. We have the testing capacity. This is what we have been waiting for, is to have the kind of capacity that you could reach out to folks, get them tested early, and have them be taken care of. And so I'm going to continue to push every limit. Those of you who've been out there, the site is a thing of beauty. How fast we are moving people through. We're running 700 people today, and other than the holdup at the beginning of the day, because the wind, high winds blew down some of the tents, so we had a backup at the beginning of the day, we caught up in about 45 minutes, and it's been smooth all day long. So testing is finally going the right direction. The other thing is we are getting excellent news out of the Detroit Police Department. And it seems like it's been one day after another of bad news here. But I just got off the phone with Chief Craig, who is very strong. He's very much in charge. He's calling and barking orders at his command staff on an hourly basis. And he wants everyone to know that his body is fighting off this infection. Nobody takes this disease lightly, but he continues to do well. We have at this point 69 employees of the Detroit Police Department and 8 employees of the Detroit Fire Department who have tested positive for COVID-19. And it's something that Dr. Dunn is tracking extremely carefully. The heartwarming news is Saturday and Sunday were by far the smallest number of new quarantines that we have seen at DPD in 10 days, 17 on Saturday and 20 on Sunday, about a quarter of what we've been running. This process of taking the officers' temperatures as they come in for each shift, giving them 2 sets of masks for each shift, enforcing social distance in these stations. Nobody wants to declare success after 2 days, but it was extremely reassuring to see that go that direction. So as of today, we have 493 sworn officers that are off on quarantine and another 105 civilians. But the trends are changing dramatically. We have 173 officers in the process of being brought back. And so I'm feeling like if the trends continue for the next few days, the manpower issues at the Detroit Police Department will be in good shape. And Assistant Chief White just shared the numbers with me as I was coming over here, but the number of crimes in this city last week were 40% below the crimes the week before. So the sheltering in place is having the same kind of effect on the crime rate here that it had in New York. And there's no doubt that the reduction in the number of police runs is helping our situation, and we are still making the kind of response time that we should be doing. We also have 109 members of the Detroit Fire Department are currently quarantined. And so what we are going to do is we are going to take the police officers and the firefighters that are quarantined, and in the next 2 days, the great majority of them will go through our test site and will be tested. It wasn't something we had the capacity to do even a few days ago, but we can do it now. And that will give us the ability to know that our officers, firefighters, and EMTs who are positive, we will get them the appropriate care quickly, and those who are negative can come back to work as they very much want to do. And so the next 48 hours, there's going to be somewhere between 300 and 400 firefighters and police officers. And then by Thursday, I intend to extend the same policy to our bus drivers, who are also out there on the front lines. And on Thursday, we will have our quarantined bus drivers be tested, and we're going to take care of our folks the way we should. The other thing that I'm very pleased that we can announce today, and I want to thank the Greektown Casino. There have been a number of police officers, firefighters, and EMTs who have said to me, I want to do my job, but when I go home at night, I've got a relative who's elderly, who might have heart conditions or lung conditions. I have a newborn baby. I've talked to 2 of our first responders who have newborn babies. I don't want to take the risk of taking the coronavirus home with me. I'll do my job. Is there someplace else I could stay? We reached out to Greektown Casino, and they are donating their hotel rooms for the next couple of months. And starting tonight, police officers, firefighters, EMTs who have got someone at home who's vulnerable to coronavirus will be able to move in to the Greektown Casino, and Greektown has been good enough to give us the key cards. Their cleaning staff has, of course, been furloughed, but the city DPW staff is going to provide the cleaning services so that we can show the men and women who are out there protecting us every day that the city of Detroit is going to do everything that we can to protect their families. So thank you to Greektown for stepping up. And then maybe the biggest breakthrough. I don't know if you saw the announcement on Friday, but the FDA has approved the instant testing kit for Abbott Laboratories. It will tell you in 15 minutes whether you are positive or negative for the coronavirus. And not only will it tell you in 15 minutes, it has a sensitivity that it can spot the virus very early on, well before there's symptoms. So where we've been saying you can't get tested until you get symptoms, this test is so sensitive that you can give it almost instantly after exposure. And so Friday, the FDA approved this. They indicated they were going to distribute it to a limited number of communities across the country. I'm really pleased with the fact that Miles White, the CEO of Abbott Laboratories, who is retiring tomorrow after 21 years, I managed to get his cell phone number and woke him up on Sunday. And he got over that pretty well. And by the Sunday afternoon, the new CEO coming in, Robert Ford, and we had signed a contract. And in the next week, the city of Detroit, if not the first, will be one of the first cities in America that will deploy the instant testing kit. 5 testing machines and 5,000 testing samples are on their way to the city. They'll be up and running within a week. And here's what we're going to do with them. What the instant testing should be used for is for first responders and health workers. And so I want to be in a situation that if a police officer comes and says, I just arrested somebody, took him to the Detroit Detention Center, and I think he's positive for COVID-19, I'd like to be able to get that officer tested and in 15 minutes be able to say, you're positive or you're negative. And that's what this is going to be able to do. We're going to run 250 tests a day that will get instant results to our first responders and to our bus drivers, so they know. And I can't say enough good. This Abbott Laboratories group is about as professional an operation as I have ever seen. To start on a cold call on Sunday morning and to have a contract by Sunday afternoon, and Boise Jackson and the procurement team of the city of Detroit were great. But I didn't really want to wait around until Monday, till the rest of America was descending on them. But they were terrific. The other good news is that they will be providing kits to hospitals in southeastern Michigan. A number of hospitals already have Abbott testing machines. If you've ever had an instant flu test, it was probably done on an Abbott machine. The hospitals will simply be able to swap out the flu test for the COVID-19 tests. And so what the hospitals are going to do is use these for their healthcare workers, because there's probably between 500 and 1,000 healthcare workers in the southeastern Michigan hospitals that are today quarantined. And we need to get those health workers back to work. I don't know whether we're going to need the surge capacity over at the TCF Center where the Army Corps of Engineers is building that field hospital. We have to prepare as if we do, but we will not be able to staff that field hospital if you got 500 or 1,000 healthcare workers who are off on quarantine. What the Abbott test is going to do is allow the hospitals to know immediately, are my nurses, doctors, healthcare technicians positive or negative, so you know whether you can keep them on the floor. This is a game changer for the country. This is what we've been waiting for as far as the instant testing. 4 and 5 days later is 4 and 5 days where people are still out there not knowing. And so I'm really pleased that Abbott Laboratories is partnering with the city of Detroit. And when I explained to them how it would keep our police officers and firefighters on the road, they stopped debating with me, and they said, we got to get this done. And they were just terrific. A couple other items. One is, I want to thank Governor Whitmer again. 3 weeks ago today, we announced the $25 water restoration program. We will have everybody who we have contacted in the last 3 weeks will be turned on by Wednesday. We're down to the last groups, other than those who need internal plumbing. It'll be about 1,000 houses that will be turned on. We've got about 150 that need plumbing, major repairs inside the houses. The carpenters are out there now. And we learned a lot in this process. We've gone out and knocked on 8,000 doors in addition to all the billboards and all the stories. There have been a number of reports about thousands of families living in Detroit without water. And never has the entity that made that report had any facts behind it. They didn't go out and talk to people and actually see if it's true. And we found that factually it's not true. That as we went through houses, several thousand where water had been shut off, we found they largely fell into 3 categories. One was the house was abandoned. A second category was there's a significant number of people who, when their water was shut off, moved out and moved in with a friend or a neighbor. A lot of these folks have shown back up and are turning their water off with the $25 arrangement, and they're going to move back into their house with the $25. And there's a third category of a lot of households in the city that have been tapped into the water illegally. That's something we'll deal with down the road. It drives up the rates that all of your neighbors pay. But right now, we're just keeping the water flowing to everybody. But there were several hundred households that it appears legitimately were living without water, and with the exception of those that need the plumbing, which we're fixing, we've turned them on. And I would say to anybody listening to this, if you know of anybody who's living in a house without water today, contact DWSD. The crews are there, they're ready to go, the backlog is cleared out, and we're here to help. There is no reason any family in this city should be living without water in the middle of this crisis. Get on the $25 program. If you don't have the $25, the state will pay it. but we just want to get the water flowing in your house. Today, we started running our food operations out of all 6 sites, Adams, Butzel, Farwell, Kemeny, Patton, and on Tuesday, Wednesday, and Friday, Crowell and Lasky. And so those sites are all operational now. If you have children under the age of 18, you can go in and get a breakfast and a lunch at these centers. There are also a number of charter schools and DPS running their centers. All of them are listed on the City of Detroit website, but there's no reason for any child in this city to be without food during this crisis. And if you don't have a car, if a friend or a relative will come out and make the run for that child, you can take it home to the children, and again, an area where we can pitch in on our neighbors. Finally, the effort on the homeless continues, I think, to be very successful. Our nurses visit every warming center and every homeless shelter in this city every 2 days for a wellness check on those who don't have a permanent place to live. And the Salvation Army has been a great partner, and today we have 29 people in the Salvation Army Center. 2 have been tested positive with COVID-19, and they are in isolation. The other 27 are awaiting test results, but we have taken them out of the broader shelters and warming centers so that the homeless in our community are not subjected to the spread of this disease. And when the Salvation Army reaches its capacity, we have another building with Detroit Rescue Mission Ministries as well. But I want to say thank you to Arthur Jemerson, Don Rencher, and the team that is working on that. And one last point that is not COVID-19 related, but is another disaster issue. Many of you will remember last spring, the Jefferson-Chalmers neighborhood was underwater as the Detroit River came over the banks. There is no reason to believe that the water levels are going to be any lower this year. And instead of waiting till June to scramble and deal with it, the Detroit Water and Sewer Department, the General Services Department, has gotten ahead of it. And the Detroit Water and Sewer Department has spent $2 million to buy so-called tiger dams, which are basically huge tubes that raise the level of the bank by 3 feet all the way around. Those tiger dams will start to be installed in the next week, and weather permitting will be fully installed by the end of April. But the last thing I wanted to see was telling people to shelter in your homes and then find your homes were being flooded. And so a special thank you to the Army Corps of Engineers that played a central role in designing the tiger dams, and the neighbors in Jefferson-Chalmers. In the next week or so, we'll see the crews out and doing everything we can to protect you. As I said, the numbers are going to continue to grow, and we have got to practice the social distancing. We just have to. How fast this disease spreads right now is controlled by only one thing, and that's your behavior. And it's important that you speak up when you see people gathering. Call the police. We will break them up. At this point, every police officer understands how deadly the groups gathering can be to everybody in this city. We'll come out and respond. And at this point, I'll turn it over to our director, Denise Fair, to give you the latest day's numbers and talk about what the Detroit Health Department is doing. Denise?
Thank you, Mayor Duggan, and also thank you to you for your continued partnership and leadership during these unprecedented times. So as of today, the City of Detroit now has 1,804 confirmed COVID-19 cases and 50 deaths. The information is changing daily, and we are in constant communication with the state, the CDC, and local health departments. I want to make sure I stress this. COVID-19 has no geographic boundaries, and people of all ages and socioeconomic backgrounds have been and continue to be impacted. I also want to comment on the city's new testing initiative, which will allow everyone, including first responders and also bus drivers who need a COVID-19 test, to get the test and also to get their results quickly. This, of course, means that the number of COVID-19 cases is going to increase dramatically. However, this is an important step towards our overall goal of slowing the spread of COVID-19 in our community. And as the city of Detroit and the Detroit Health Department work together and to ensure this new testing system is up and running, and including transportation, I encourage everyone to practice home and hygiene protocols, which I mention all the time, making sure that you're washing your hands with soap and water, using alcohol-based sanitizer. When you are coughing into a tissue, coughing into your sleeve, and most importantly, staying home. I can't stress this enough. We all have a responsibility, and we need to make sure that we are staying home. The Detroit Health Department, we are available to the community and healthcare providers 24/7, 7 days a week, 24 hours a day to answer general questions and concerns. You can call us directly at 313-876-4000, or you can send us an email at dhdoutbreak@detroitmi.gov. We will be responsive and answer all of your questions. I also encourage everyone to visit the Detroit Health Department website for the latest data and information concerning COVID-19, and that website is detroitmi.gov/coronavirus. Again, thank you to Mayor Duggan for your foresight and your continued support of the Detroit Health Department, and to ensure residents in our care are healthy and safe. And so with that, I'm going to turn it over to Mayor Duggan for questions.
And before I take questions, one of those 50 deaths was State Representative Isaac Robinson, a good friend who was so passionate about this city. And those who knew him knew he was a joy to be around. He knew every little restaurant in every corner of his district and who had the best cooks, the best service, and he was just a pleasure to be with. And our thoughts are with the Robinson family today, and it's just a reminder of what's at stake in following the social distancing rules. It's a matter of life and death. And with that, I'll take any questions. Good.
So with the TCF being changed to a field hospital, that is much less than what I think Dr. Calvin said it might be like 10,000 beds in Michigan. And I'm just curious, have you thought about other possible sites, or are you expecting there will be others?
Yeah, I mean, if you look at what New York is doing, I think they've got 8 or 10 of them spread around the region, and the Army Corps of Engineers is working with the governor to follow the same practice here. And so TCF Center was the place where you could get the most beds in the shortest period of time, but we are actively pursuing with the state, and the state is doing this statewide, and the Army Corps, other locations. And so it's anybody's guess. Somebody from the state of Washington put out some projection that we would peak on April 8th. I will be the happiest person in the world if we peak on April 8th, but I don't see today how that's realistic. I think this is going to be a several-week fight. And so are we going to need any field hospitals? Are we going to need TCF and others? I can't tell you today, but I can tell you Dr. Khaldun and the Army Corps are just doing a great job at developing these alternatives. But my guess is you'll hear about more. Yeah, it's right. When you're talking about Detroit, they're talking about the Detroit region. Okay, we shouldn't lose sight of the fact Beaumont in Royal Oak filled up before the Detroit hospitals did, and at least as of yesterday, the city of Detroit and Oakland County had similar numbers in a number of regards. But there's no question that we have more density and we're more at risk. You're also seeing the Chicago area and the New Orleans area are also hot spots, and you're going to see this, I think. Major cities in America that are destinations that lots of people come into are likely to develop. And I think it's a matter of time before you see Philadelphia and Houston and some other cities develop the same way. So Vice President Pence has been great. The Dr. Hahn, the head of the FDA, we are now communicating continually, and he moved forward on a testing program that Henry Ford very much wanted to do in like record speed. And so I'm starting to see good support out of the federal government. I think they are growing into the role of recognizing they do need to be the leader of the supply chain for America. And if they play that role, we're going to have the resources to fight this thing off, and that's what we're trying to do. So I have been learning from Governor Cuomo, who has done a phenomenal job. I've learned from Jenny Durkin, the mayor of Seattle, who dealt with this early on, and we are sharing all kinds of things. But now the U.S. Conference of Mayors is asking, now what are we doing in Detroit? And so that's not really the place I wanted to be, that people were calling me to ask how to deal with the coronavirus. But it is rapidly getting to the point where people are asking us. But everybody in the country is pulling together. We call out to New York and want to know the details of how they do a drive-through site, the details of what kind of a medium they use for their testing. BioReference Labs, that's driving us, is doing the bulk of the testing in New York, so we benefited from that. The mayors and governors in this country are pulling together, and I think the federal government is starting to unify behind us.
Mayor, question from Frames. The supply of swabs, PPEs, and test kits for the state fairgrounds, how is the supply and
So I go right down the line. So the swabs came from Dr. Roberto Romero and the perinatal research branch. And so they were not swabs that were normally used in a medical practice in that way, and we're in good shape there. A number of the PPEs were provided by some of the individual hospital systems, but most of it came from our allocation from the state and the federal government. And some of it is Boise Jackson, our procurement director, who is on the phone day and night buying it from wherever it's available. But we are still in good shape. I'm trying to stay 10 days ahead of time on supplies, and right now we're 10 days ahead of time on supplies, which in this pandemic is an eternity.
When the city is quarantining fire and police, are they doing it for 14 days right now?
Right. Right. So the question is, how is the quarantining of police and firefighters happening? And so we've talked about this before. If you have been exposed to somebody who has COVID-19, we have quarantined you for 14 days. That's going to change now that testing's available, because once you're tested negative, we can send you back. The problem was we didn't have testing available, and so we quarantine you for 14 days to be safe. If you've been exposed to somebody who a doctor has ordered a COVID-19 test, we quarantine you until that test comes back. If the test is negative, you come back to work. If the test is positive, you're off for 14 days. All of that is about to become irrelevant when the Abbott lab machines get here, and we can tell people quickly and accurately whether they're positive and negative.
So right now the turnaround's about 3 to 4 days?
I would say 3 to 4 days out of our state fairgrounds test site, and it'll be 15 minutes when the Abbott lab machines get here.
There was mention of reducing the requirements to get a prescription.
Right.
And so I guess who's establishing what the requirements to get?
So Dr. Khaldun sets out a state guideline in which she looks at the testing capacity in the state, and if the testing capacity in the state is, 10 days ago it was 125 a day, now it's probably, before us it was probably 1,000 a day, now it's probably closer to 2,000 a day. She sets the standards of who can be tested, based upon what the lab capacity is and what the swab and medium or reagent capacity is. And now that a number of the hospitals are expanding their lab capacity, Henry Ford's been extremely successful, and I think DMC and Trinity are very close to expanding their lab capacity. So if we can get the swabs in town, which we are working furiously, Senator Stabenow and our congressional delegation is all over FEMA right now. You wouldn't think swabs would be the biggest problem, but at the moment, they're a significant issue. If we can get the swabs in town, you could see a dramatic expansion of testing in this state within a week or two. And what Dr. Khaldun has to do is increase the standards as the testing is there. And so she and I talked today about the fact that in southeastern Michigan, with the fairgrounds being able to do 700 a day, it's time for a lot of folks who really needed a test, but basically got triaged out. It's time to tell the doctors, we can open up the testing and you can use your judgment and order tests for who you think needs it.
So for the average testing, I know that that's going to be really primarily for our first responders.
Right.
Hope that will soon transfer over to testing back in the state for
No, the whole point of what Abbott is doing is for first responders and healthcare workers. So they are hoping to ship something like 40,000 kits a day nationally. That basically will cover your healthcare workers and your first responders across the country. And so I'm not a doctor, but what the doctors tell me is if you've got a patient in the hospital, you pretty well know what the symptoms are, and you treat a breathing disorder the same. The test that the hospitals need is to know whether your nurse needs to be sent home because they're contagious or whether they can stay on the job. And if you're sending home nurses for 14 days at a time and you're working all the others overtime, that's a really unhealthy situation. And so what Abbott Labs is doing is driving these kits nationally to hospitals and first responders. That's their niche, is what this country needed, and that's what we're using it for. Now, there'll be a day when everybody has a 15-minute test, but that's months away.
How long does it take after you've contracted it to where it can be tested?
Within a day or two. Yeah, it's so after I woke up Miles White, he gave me a long lesson in molecular measurement and why his machine can spot the virus in the structure immediately as opposed to needing the higher viral loads later on in the process. So he's justifiably proud of it, and I got the lecture from the expert. But if this Abbott Labs product works as it is supposed to, and they certainly are a first-class company, it's going to make the hospitals, police departments, and fire departments in this country far stronger in fighting the coronavirus.
A couple of follow-up questions on quarantines. Do we know how many DDoT drivers?
I don't know the number. I can. The question is how many DDOT drivers, but it's dozens.
And do you know what the total manpower is of the fire department?
It's in the range of 900. So the fire department's got about 900 people. So a little more than 10% is on quarantine, and we're covering it with overtime right now. While all the firehouses are open and operating, but it would be a lot easier if we didn't have to run overtime for the length of this pandemic. Anybody else? Oh yeah, Quicken Loans has been amazing. So when you call up to make your appointment, it is the Quicken staff that is doing it. I have no idea how we could have gotten this testing site up and running without Quicken running the phone banks. And so they send me an update every 2 or 3 hours on how many are booked, what the schedule is, how many slots we have. Quicken has just been a phenomenal partner. All right, thank you all very much.